NEET PG 2026 pattern has changed. Now you will also have to change your preparation strategy to ace this exam. Hello everyone, I am Dr. Mayukh Hazra. What is there in the new pattern? What has changed? At first, it is a 180 questions game. Instead of 200 questions, that is 20 questions has been reduced. It is again a session based exam. This time it is a single shift exam, which is a sign of relief because there won't be any normalization. It has 5 sections like the previous time: A, B, C, D, and E. Each section is having 36 questions and 42 minutes time. If your A session is over, then you reach the B session, you can't come back to the A session. At the same time, if you are in the B session, you can't go to the C session even if you have completed. After the timer of the session is over, the game is over. So this is not a single exam. This is a combination of 5 exam in total. Each of the session is a completely different exam. You will have to take it like that because your previous session should not affect your next session. At first, let's see the NEET PG 2025 marks versus rank and the top streams that were available. If you follow me on the Instagram, then you have seen this. But ऐसा तो होगा नहीं ना, because marks कम गया है. So what should be the ideal cutoff? What should be the expected marks versus rank taking in account of NEET PG 2025? So मैंने simple math किया. The marks into 720 by 800, what it is coming? This is plain and simple mathematics. This has nothing to do with the reality, because in reality the competition is increasing. The question pattern difficulty may be different, so it may vary. But taking in consideration, अगर नीट पीजी का सेम क्वेश्चन रहता और सेम कंपटीशन रहता, तो ये वाला सिनेरियो होता 720 मार्क्स में से 599 मार्क्स टॉप 100 रैंक, 550 marks top 2000 rank. If you are aiming for radiology nuclear medicine, you can get it. But previous year nuclear medicine cutoff was within 1000, so you will have to target approximately 570 marks, approximately, or 560 to 570 marks for nuclear medicine. 532 marks 4000 rank, you can get dermatology medicine. 525 marks 5000 rank, pediatrics, DNB radiology and DNB dermatology. 10,000 rank, you can get OBGY, chest medicine, surgery, orthopedics, emergency medicine. 480 marks if it is 15,000 rank, PMR, palliative medicine, eye, ENT, psychiatry, DNB pediatrics, DNB medicine. 20,000 rank, radiation oncology, anesthesia. 25,000 rank, 447 marks, DNB surgery, DNB psychiatry. 436 marks, 30,000 rank, DNB anesthesia, DNB OBGY, DNB orthopedics, DNB eye, DNB ENT, DNB CTVS. 409 marks, 40,000 rank, pathology, transfusion medicine, DNB family medicine. 50,000, 384 marks, DNB pathology. 360 marks, 60,000, community medicine. 338 marks, 70,000 rank, pharmacology. 295 marks, 90,000 rank, microbiology. 276 marks, 1 lakh rank, anatomy. And 257 marks, 1 lakh 10,000, anatomy, physiology. So if you are new to my channel, then do consider subscribing, because like this well researched videos for NEET PG, INICET and FMG preparation, no one else is bringing. Coming to the FMG secret, let me tell you a secret. 50 to 60% topics of NEET PG 2025 were repeated from FMG July session 2025, and 10 to 15 direct or similar questions were there from FMG July 2025 in the NEET PG 2025 paper. That means first thing that you have to do is you will have to solve the FMGE recall session in your app, either Marrow or Prep Ladder, which is authentic. Okay, either Marrow or Prep Ladder, you solve the authentic recall of FMG. This is your first task as soon as it is released in the app. Number two is this year FMGE, it had video based questions. These were not GIFs, but it did not have any sound. 10 to 20 seconds video, nystagmus video was given. Some of the logos of who were given in the form of video. So if you know the image, you can crack the question. Gait was given, movement disturbances, movement disorders videos were given. Approximately 20 questions were video based questions. So there is a high probability that in NEET PG also video based questions will be given. Number two, more image based questions were given and the difficulty level was high. That's why FMG pass rate dropped down to the lowest of 12.77%. This shows that NEET PG 2026 pattern has changed. Maybe it can shift towards a difficult level, more of image based questions, more of video based questions, and more of clinical based questions rather than ratifying the stuff. So, what to do now? The pattern of the question has changed, and this is the new pattern. So, if I give you this 500 rupees notes, will you take it? You can take it for showcasing it, but this 500 rupees note is of no use now. So all the old GTs are of no use now for your preparation. Now you will have to give the new GTs only, either Marrow or Prep Ladder, because these are authentic apps and they have huge resources, so they can easily adapt to the new exam pattern. Other apps will also adapt, but it will take them a bit of time. How to approach this session based exam? Follow my technique, that is 9 questions in 8 minutes. So 36 question is solved in 32 minutes. If there is any long stem question, any confusing question which is taking a lot of time and you are stuck in that question, leave it for the time. Okay, you solve 9 questions in 8 minutes. See the timer, you are solving 9 questions in 8 minutes. Rest 10 minutes, because 36 question is solved in 32 minutes. 42 minutes is the session, so you have 10 minutes in hand. Now you return back to the question which was taking you time. Now you give time to think that question, because you will have to see all the questions. If you miss one or two questions, it can affect you havocly. So at first finish all the questions, then return back to the question that is taking lot of time. After that, if you have time, then review from 1 to 36 all the questions, because many times there are silly mistake that you tend to commit. So I also reviewed from 1 to last all the questions. So it is better if you review 1 to 36 all the questions. Coming to image based questions, according to my knowledge of NBE, image based questions, 90% of the images are the clinical photos of the examiner, so you won't get them from the browser. Some subjects like pre paraclinical subjects and radiology, some of the images you will get direct search from browser. So you can study them from your notes, or you can purchase my digital image bank pro. It has 1850 plus images, and all the previous year questions like transient tachypnea of newborn came, so they are marked with highlighter and as a PYQ. So link is given in the description box below and pinned comment section. You can check it. Coming to video based questions, as I said that there are high chances that video based questions are going to be asked. First thing is you solve the new GTs, there will be the video based questions. Second thing, you follow the coaching media apps from an Instagram account, maybe not your personal account, make a study account and follow them, because they are giving video based questions. And you can go through my free video based questions list. It is available on my Telegram channel and WhatsApp channel. The link is given in the description box below and pinned comment section. And in paid, you can go for the apps, maybe they will launch some other course or they will include video based question. You can go with the apps, or you can join my Telegram channel. There I am giving daily 4 to 5 videos. Okay, and on 20th of August, I will give the whole video bank, where if you collect the drive link, all the videos will be downloaded and you can see them ad free. The link is given in the description box below and pinned comment section. This is the photo of the road not taken by Robert Frost. The last line where I chose the one less traveled by, and that has created all the difference. So don't choose the road less traveled by. Follow the strategy followed by toppers and all the rankers. That is the triangle of success. Still now it holds true. First thing is the previous year topics. Most important is the NEET PG FMGE. After that is INICET. In my times, every faculty and every mentors used to say that you need to practice NEET PG and INICET previous year questions. But one of my senior who scored AIR 500, he said that some of the questions of FMG, which are not that much common, are repeated in the NEET PG. So I practiced 3 years of FMG, and yes, some of the questions which are FMG favorite, but the NEET PG aspirants don't know, they are asked in the NEET PG exam. So according to me, NEET PG FMG questions are more important than INICET. How many years? According to me, best is 8 years of NEET PG, 8 years of INICET, and 3 years of FMG. But if you have less time, then 5 years of NEET PG, 3 years of INICET, and 3 years of FMG. With that, you will have to give the GTs, and you will have to revise multiple times your concise source, at least 5 times. 5 times is the least number of revisions you should do to crack this exam. Another important thing that no one else is highlighting, no coaching app or no faculties are highlighting, the negative ka funda, tie breaking criteria. Because same marks, there will be many students. As the total marks has reduced from 800 to 720, more chances that in the same marks, more number of students will be there. So at least 400 to 1200 students will be there in the same marks in the clustering zone. For that, tie breaking strategy is number of negatives. There are high chances that you will have the same number of negatives as that of 1000 students. So what is the next criteria? That is session wise negatives. First your A session will be seen, then B, then C, then D, then E. So how to approach this? You will have to play like the cricket players. First they adjust in the pitch, then they have a strike rate of 100, and in the last overs they play it, they have strike rate more than 140 or more than 160. So in the first section, that is the A section, you will have to hold. Don't over attempt. If you are confused between three options, you will have to think twice before attempting. If you are confused between two options, always you should attempt. If you are having any intuition, go for that, or you can rule out the other option, go for that. But the first intuition you are having is 7 out of 10 times correct, so go with your first intuition if you are confused between two options. After that, in B and C session, you play it moderately, not too much safe and not too much aggressive. In D and C E session, you play aggressive according to the exam pattern. The next criteria is the MBBS aggregate marks. So fill correctly, because if you fill it incorrectly during your admission, there could be a mishap. Because one of the doctor of Gujarat, his admission got cancelled because he filled up wrong data in the MBBS aggregate marks. Age, the older the age, the more the advantage. But I think it is highly unlikely to reach this criteria. According to me, ideal number of attempts, it depends completely on the exam paper. If it is difficult, you will go towards 160s, but if it is easy and you want to top in the top 100 or top 1000, then you go for 175. You can go for 175 or even more than that if you are attempting a top 100 rank. So all the best for NEET PG, and if you are preparing for NEET PG, INICET or FMG, join my free Telegram channel. The link is given in the description box below and pinned comment section. Now you can see a video on video based questions. So go watch it.